My name is Tara Talbot, student number T007-45663, and this is my demo dog, Saber. And this is my video on a cooperative vet care experience for our animals. So going to the vet clinic can be a daunting experience for them. So by doing training with them at home, or even using some of these techniques at the vet clinic, can greatly reduce their fear, anxiety, and stress at the vet clinic. So main thing that I like to start with is getting them used to being on an exam table. So Saber really doesn't, even though he does sports like wall climb and stuff, jumping 10 feet in the air, he knows that being on the exam table means that things are going to be done to him. So I really like to make it a positive experience by giving him treats. A lot of people think that it's impossible to do, but I mean, if we can train zoo animals like bears or seals, I don't see why we can't train our dogs and cats to enjoy and cooperate while being at the vet clinic. So he's already kind of used to being on higher tables for exams, even though he knows I'm going to be doing things to him. So one of the things that I like to train while he's on the table is things such as grabbing his muzzle. So if we need to do blood collection and stuff, he's used to his muzzle being grabbed already. Good boy. I'm just gonna turn him around a bit. Lay down. Good boy. So all ready for a jugular. He's already good for it. He's used to his head being grabbed like this. It can be harder with fully grown animals just because they've never had it done before, but you know, with enough training, I think that you can get them to a point where they'll at least allow you to do it. They may not enjoy it or be comfortable, but they can accept it for a short period of time. So he's already used to me lifting his lips so that I can examine his teeth open. I've brushed the insides of his teeth. Most people can't even brush the outside of their teeth, but because we do it so often, he's already used to it. So I can examine his mouth, lifting his ears, looking inside the canal for taking his temperature even. I started with him as a young puppy, playing with his toes. And then even though he doesn't like nail trims, he still tolerates it really well. There's no resistance from him. A lot of dogs, that handling their paws can be a big no-no for them. So I do like to use like gabapentin or trazodone for extremely fearful dogs. But when we have puppies or dogs with better temperaments, it can be quite easy. And see, he still doesn't like it, but it's still a positive experience for him, and he accepts what I'm doing to him. He's really good for this. Also getting them used to moving their legs for them. That way, you know, when a vet is trying to check their mobility, it's super easy. Another thing that you can practice with is getting them used to a basket muzzle, or even a cloth muzzle, or even a gauze wrapping around. So what I would do personally, you could use a clicker for this, but personally I just feed treats through the muzzle. So I would hold the muzzle, and through the muzzle I would put a treat, and the dog places their muzzle in the basket, and it's super easy that way. Some dogs will fight it, but I found that most dogs are willing to accept a muzzle if you take the time to go at a slow pace and get them used to it. It can work really well. Another thing that some dogs aren't used to is collar grabs. So a collar grab, some dogs can react to that. He's very used to being held by his collar. It doesn't bother him. Same with their harness. If they prefer a harness, grabbing it so that it doesn't scare them. If the owner grabs it at home, you can get them used to it that way. Also putting a slip lead over the head, because sometimes something going over the head, they can shy away from it. So using treats to get them used to that experience can greatly help them. Another thing is crate training. A lot of people can think that it is cruel to keep them in a crate. However, even just to have it so that they get used to it enough so that they're willing to accept it at a vet can greatly decrease their stress. A lot of dogs and cats don't like being put into a kennel, let alone all the smells and stuff at the vet clinic. So by getting them used to a crate at home can make a huge difference for their experience and their recovery. He's very relaxed being on a table. Once you practice enough, you can give it cue words, such as nails, and he'll be ready for that nail trim. For our surgical patients, we can't be feeding them a ton of treats. So maybe a toy, or if you're not trying to stimulate them, simple praise is often good as well. Hey, bud. You can also use a lick mat, and that can help distract them. So I'll just demo some of the things I've gotten him used to. Hey, can you sit? So this is for a jugular blood collection. He's not happy, but he's totally cooperative. It doesn't bother him at all. And for an IV catheter, he doesn't care. The other thing, rolling them on their side. Well, he wants to roll the other way. Hey, lay down. Good boy. It doesn't matter to him because I've practiced so much with this dog that while he's not like having a great time, he's not fearful or stressed. And same with at the vet clinic. I know we're at home right now. Good boy. He automatically knows that if he does what I ask of him, he gets a treat out of it, or praise, or toy, or he gets to go home faster, right, buddy? So I really think it's important for pet owners to train their dogs how to cooperate with simple vet restraints and techniques so that we veterinarians can better examine their animals and also decrease their stress while they're in veterinary care. He's almost gonna roll off. He doesn't care. And he does this at work too. Even when we were practicing putting a splint on him, which he's never had done before, he laid there for 15 minutes while I practiced wrapping gauze around his leg because he's so used to being handled at the vet clinic. And I know that some owners will say, well, that's because you work at a vet clinic, but I didn't 4 years ago. And I still had animals that were willing to accept veterinary care, and it wasn't stressful for them. I do know that pain can sometimes cause them to react in a way that they normally wouldn't, and that's why it's good to get them used to wearing a basket muzzle, or if they can't afford a basket muzzle, just lightly putting some gauze around their mouth, as a lot of vet clinics will use that instead of trying to get a basket muzzle on them. So that's my video on cooperative veterinary care. Thank you. Thank you, Saber. Good boy.